Hello, everyone, and thank you for joining us for today's webinar, Digital Enhancements for Operational Excellence. I'm Heather Masaccio, your host from Pharmaceutical Online and Life Science Connect. Our speakers today are Nick Armstrong, Senior Director, Digital Enablement, and Josh Hoops, Vice President, Mission Critical, both with CAI. Just a bit of housekeeping before we get started. If you have a question for our speakers or wish to share any thoughts of your own, please submit it through the Q&A box on your screen. If you run into any problems with the stream today, please try refreshing your browser first. If your problem persists, please use the Q&A tool to submit a question and I'll help get you back on track. This event will be available on demand, normally within about 24 hours. Just use the same link that you used today. I will now hand it over to Josh to begin the presentation.
Awesome. Thanks, Heather. And thank you, everybody, for joining Nick and I today to talk about the digital enhancements and for operational excellence. So I'm just going to give a little bit of introduction here, and then we'll get into the meat and potatoes of it. So each of us faces the same fundamental constraint, time. No matter how skilled we are, or how much experience we have, or how many resources we control, time is the ultimate limitation. And in life sciences and in the mission critical industries, time isn't just a limitation, it really is high stakes. For example, the time it takes to bring a life-saving drug to market, the time a mission critical facility is down, risking millions in lost operations, and the time spent on inefficient workflows, repetitive tasks, and even outdated processes. And the chances are, if you're here, you are interested in becoming more efficient. The reality is that we are all limited, I would say, in our capacity to accomplish the tasks we've really set out to achieve on a day-to-day basis. And this is because of time. Compared to the rest of human history, I would say technology and innovation have really just barely reached infancy. So let's talk about our own personal limitations for a moment. The human brain can only produce so many outcomes over a given period of time, efficiently. In today's environment, it's even more difficult to be efficient. So let's talk about the downside of technology for a second. It tends to force us into what most of us kind of term or think of as multitasking. The reality is that multitasking is horribly inefficient. In fact, chances are most people here are multitasking at this very moment. You're writing an email, you might be texting, you're scrolling through LinkedIn, working on a spreadsheet, and you're listening to me in the background. Believe it or not, this is not an efficient use of your time. What we call multitasking generally is actually context switching. And research shows that context switching makes us about 40% less productive. So AI isn't a new concept. In fact, as I was preparing for this webinar, I dug out an old textbook from my college days, Artificial Intelligence, A Modern Approach, published in 1995. You probably can't see it because of my background. To be honest, I remember 100% nothing from that course. At the time, AI was just a theory. It really was just a glimpse into the future. Today, that future is here, for sure. As I was scanning the book, I flipped to the last page, and humor me for a minute while I read the last paragraph of the textbook. It's not long, I promise. Looking on the bright side, success in AI would provide great opportunities for improving the material circumstances of human life. Whether it would improve the quality of life is an open question. Will intelligent information give people more fulfilling work and more relaxing leisure time? Or will the pressures of competing in a nanosecond-paced world lead to more stress? Will children gain from instant access to intelligent tutors, multimedia, online encyclopedias, yeah, I kind of laughed at that, and global communications, or will they play even more realistic war games? Will intelligent machines extend the power of the individual or of centralized governments and corporations? Science fiction authors seem to favor dystopian futures over utopian ones, probably because they make far more interesting plots. In reality, however, the trends seem not to be too terribly negative. So the point is that we're evolving rapidly. Granted, that book is from almost 30 years ago, and we need to really dive into how we can capitalize on this new technology and the innovation, AI specifically, to improve our efficiency. Just as a single point example, everyone knows about ChatGPT, and likely 2 years ago, the vast majority of people here maybe never even heard of it. And you most likely use it every day, or at least a few times a week. It's a useful tool to improve efficiency and saving time. And this is really just the beginning. So as we go into this, let's kind of break this up. So operational excellence really is about achieving the highest standards of performance and quality. But traditional methods of operational excellence, manual observations, using historical data, and intuition, they really have their limits. They're often reactive, they're slow, and they're disconnected from the full picture. That's where AI and digital tools, where we think they come in. They don't really replace expertise, they enhance it. AI really enables real-time process visibility. There's predictive insights, and it's all about continuous improvement at a scale that we really haven't seen before. Here at CAI, we just don't want to follow the industry standards. We want to redefine them. We want to use cutting-edge technology and deep industry experience that we have to ensure operational excellence isn't just maintained, but we're really just continually advancing it. So let's take a closer look at how AI is transforming the industries that we're serving. AI, as I mentioned earlier from the textbook, it's not a future concept. It's actively reshaping how we're operating in life sciences and mission critical facilities around the globe. It's making processes faster, smarter, and more connected. But AI alone isn't the answer. The impact comes from how we apply it. Here at CAI, what we're really wanting to do is pair cutting edge technology with deep industry expertise to drive operational change. So let's explore a few key areas where AI is transforming the industries that we serve. First is in machine learning and R&D. AI models like AlphaFold are solving complex challenges like protein folding in seconds, where previously it could have taken years. This isn't just about speed, it's about the precision, it's about accelerating breakthrough therapies. And then second, there's knowledge graphs and product development. Innovation depends on connectivity, but life sciences data is often siloed, as everybody here most likely knows. AI-powered knowledge graphs unify the information across R&D, manufacturing, regulatory teams, and even improves decision-making and compliance. And third, patient digital twins in clinical trials. Well, AI really just enables that predictive modeling of patient populations. It simulates the drug responses before even trials begin. This improves trial design, reduces the risk, and at the end of the day, which is most important, is it speeds the life-saving treatments to the market and to the patient. Beyond research and development, AI is redefining mission-critical operations. So let's talk about that for a second. Again, we want to capitalize on our expertise across mission-critical industries with the AI-driven solutions that we're looking into to enhance those operational performance while maintaining the reliability and redundancy requirements that we see in the mission-critical facilities around the globe. And so there's three areas here. Predictive maintenance is the first one. AI leverages real-time sensor data to detect potential equipment failures before they occur. Now, this isn't a new concept. We've been talking about predictive maintenance for years. However, the AI really is established to optimize asset performance and mitigates the costly disruptions that could occur when failures occur that weren't necessarily planned for or seen. Second, there's AI-driven capacity planning. In a high-demand environments like data centers, for example, and advanced manufacturing, AI dynamically optimizes those workloads, and as well as the energy consumption and the infrastructure capacity. And what this does is it just ensures that there's seamless scalability and resource efficiency, which is really what it boils down to. Digital twins for energy and operations. This is a really cool technology, and digital twins provides a real-time, data-driven replica of a facility, allowing the teams, operations teams, to simulate, test, and optimize those operations before implementing change in the physical environment. And this enhances that decision-making and really provides outstanding operational agility. At CAI, we believe readiness is not reactive, that it's engineered. So let's explore what's next and how organizations can position themselves for the future. Let's face it, AI isn't optional. It's essential for staying competitive. I think that much is clear. But adopting AI isn't about upgrading systems. It's really about rethinking and reshaping how we scale, adapt, and sustain optimal performance. If you think about capacity for a second, scaling for AI-driven growth is pushing infrastructure to its limits. Life sciences must expand production to deliver therapies faster. while high-performing facilities such as data centers must keep pace with the rising computational demands. We have to think about agility, adapting regulatory and operational shifts in AI and digital twins really just enable that real-time adjustment, whether responding to new regulations in manufacturing or optimizing operations to meet shifting demands. And finally, there's sustainability. AI-enabled efficiency workloads drive higher energy use, smart automation, and predictive optimization that will balance the performance with that sustainability, which is really key to meeting those demands. Digital transformation is accelerating rapidly, and proven methodologies like Lean and Six Sigma and all of those things, they remain critical. So let's take a look at those real quick. So what is operational excellence? Really, it just comes down to consistently delivering high quality outcomes by eliminating inefficiencies, reducing the variation of the outcomes, and driving that continuous improvement, which is really what the key element here is. Over the years, the methodologies that are shown here, like Lean and Six Sigma and TPM, they've been well developed over decades, and they provide structured ways to achieve these goals. These aren't just process improvement tools, they're disciplined approaches to making organizations more agile, efficient, and resilient. While AI, digital transformation, introduces new capabilities, the core principles of operational excellence, or OE, remain that foundation. The key is how we integrate it, integrating the methodologies and modern technology to really amplify that impact. Okay, so that's a high-level overview of what we're talking about today. I'll hand it over to Nick, where he's going to talk about the technical aspects of the digital twin and AI itself. So Nick, take it away.
Thank you, Josh. So as stated earlier, I serve as the head of the digital enablement group here at CAI. Been at CAI 7 years now, but prior to that, I spent 10 years in the industry as a process and reliability engineer. So I spent times in the cell culture pilot plant, scaling up cell culture processes, whether it was down on the GMP floor, troubleshooting a protein A capture column in clinical manufacturing, or working in a cross-functional across sites on global reliability strategy. I really did enjoy my time on the front lines of delivering therapies to patients. Now in my new role in I started my new role in digital enablement about 2 years ago. And at that same time, ISBE was establishing their community of practice on artificial intelligence. And I'm happy to say that I serve as the co-chair for that organization today. My remit is twofold. Number one is to discover, develop, and deploy emerging technologies that help our field teams to deliver more efficiently and more consistently for our clients every day. And my second remit is to define the digital twin and artificial intelligence strategies for the company. So today's presentation will focus on digital twin technology and artificial intelligence. And while these technologies may have as many interpretations as there are attendees on this webinar, it is my sincere purpose to share a practical use case to improve your operational excellence program using a digital twin, as well as understand a front edge in AI to organizing and connecting information so AI and people can work together to see relationships, uncover patterns, and better decision making. As Josh said, operational excellence is an important framework for us to improve plant output and reduce variability. But OE isn't just about processes and metrics. It's about where the work happens, and this is where Gemba comes in. Gemba is about three things: observing work, engaging with teams, and improving processes. It's meant to drive real-time problem solving at the source. But too often, Gemba walks drift into compliance checks, focus on audits, fixing isolated issues, and meeting reporting requirements. Why? Because manual documentation and tracking slow everything down. Instead of solving problems, teams get stuck managing paperwork. We plan to bring Gemba back to its purpose using SiteSync, removing the administrative burden and restoring its true purpose. Let's see how that works. We've replaced the clipboard with a mobile device. Instead of taking handwritten notes that need to be transcribed later, observations are captured instantly right at the source. The process starts with a simple tap. Dropping a pin on the exact location of the observation, this not only starts the ticket, but precisely geolocates it, ensuring accuracy and eliminating guesswork. Next, the user categorizes the issue, adds notes, and captures photos and videos, all directly from their phone. This entire process takes just 10 to 15 seconds, compared to the old way, which required lengthy documentation and office transcription later. And now, instead of scattered notes, managers can see all findings visually on a facility-wide map. Observations are organized, trackable, and shareable, enabling real-time collaboration with teams and leadership. This is how we bring Gemba back, by making it faster, more precise, and actionable. And SiteSync's impact is real. Sites using this approach have seen a 43% increase in on-time issue closures. Faster reporting and structured tracking means problems are resolved more efficiently. For technicians, getting to the issue is no longer an issue. With precise geolocation and a built-in route feature, they can navigate directly to the problem, just like using Google Street View. This means faster response times and less wasted effort. And even beyond efficiency, the system improves team connection. The intuitive mobile-first design keeps frontline teams engaged, while a global view enables cross-site collaboration and best practice sharing, so every site benefits from collective knowledge. Now, at this point, you may have noticed we haven't shown a digital twin, and that's because it's the engine behind all of it. It's what enables you to seamlessly interact with your physical world digitally. Let's take a look under the hood. Sorry, that shouldn't be there. This is Andrea, one of our reality capture experts, especially trained in using the VLX LiDAR scanner, a tool designed for speed and precision. It's incredibly fast, capturing 150,000 square feet per day. To put it plainly, that's an entire building, inside, outside, and even the roof. Processing just takes another day, delivering a high-fidelity model with millimeter accuracy. The result is a photorealistic digital twin, intuitive to use and packed with potential. The best part is you can layer on additional workflows like SiteSync. And in less than a week, you're operational, ready to drive immediate value. We hope that this is just the beginning of your digital twin journey. Once the twin is built, you can layer on additional features to gain additional value. We'll cover just a couple of those in the next slide. As we rethink how we interact with both the physical and the digital world, these examples highlight the role of the digital twin in operational decision-making. This example showcases multi-dimensional visualization, blending photorealistic and X-ray perspectives. This allows teams to see beyond surfaces, providing insights to what's inside, under, and beyond or behind infrastructure, bridging the gap between what you see and what you know. This enhances troubleshooting, planning, and collaboration in ways that wasn't possible before. Here, a portable asset is highlighted in green, making it a trackable object within the twin or within the model. By simply dragging and dropping the asset to another location inside the model, the location data can update instantly across enterprise systems, ensuring accurate records with minimal effort, allowing the teams to maintain real-time visibility and ensuring the digital twin evolves with operations. Now we've seen how digital twins improve interactions with the physical world, but operation data extends far beyond visualization. AI allows us to extract deeper insights and uncover patterns we wouldn't otherwise see. Let's take a closer look there. There was a time I was working for a company facing many of the challenges we do today: recurring deviations, repeat investigations, and CAPAs that never fully resolved the underlying issues. No matter how many corrective actions we put in place, the same failures kept happening. We had a strong quality management system, a robust CAPA program, deep investigations, and trending reports. But despite all of that, across the network, we were still writing off tens of millions of dollars in lost product every year due to process reliability failures. And beyond the financial impact, there were times when these failures came dangerously close to disrupting supply to patients, a risk no one was willing to take. The problem wasn't a lack of oversight or procedures, it was that we weren't seeing the full picture. To tackle this, the company launched a Black Belt Operational Excellence project, and I got a chance to be a part of the technical team tasked with solving the problem. I remember sitting in the room with stacks of deviations and CAPA reports, manually reading through thousands of records, searching for connections and patterns that our training reports had missed. And the good news is we found a lot of them. We uncovered root causes buried in unstructured records, trends that weren't visible when looking at one investigation at a time. We made changes, we improved process reliability, significantly reduced write-offs, and mitigated risk to patients. The bad news is it took 3 years. A small army of experts, and when it was done, that was it. We didn't build a system that could continuously search for hidden patterns as new ones emerged. So while we solved major issues of the day, there was no ongoing mechanism to detect future risks before they escalated. Now, fast forward to today. Now we have artificial intelligence, and artificial intelligence will simply solve all of our problems. Here's the tool, and class is over. And of course, it's not that simple, right? AI isn't a magic button, but it does enable us to do in weeks what once took years. This is how we surface thematic trends. This is how we identify major causeways. This is how we uncover hidden root causes at scale in real time. How does it work? So I'll spend the rest of the presentation walking through how we built this tool, the process, the challenges, and a real world example. Every day, critical decisions are made across quality, engineering, operations, and supply chain teams. But the data that drives these decisions is scattered across dozens of systems, each built for its own purpose, speaking its own language. A common solution is just dump everything in the data lake and let AI figure it out. But here's the problem. Data isn't just numbers. It's meaning. And meaning depends on context. Data only makes sense within the rules of the system in which it was created. Strip it from that system without understanding those rules, and you lose what makes it useful. In this graphic, each of the colors represents a different domain, and each domain, whether it be quality, engineering, or supply chain, has multiple systems. But within a domain, these systems largely follow similar rules, speak similar languages, and share a similar common structure. It's when we move across domains where context starts to significantly break down. In that graphic, the systems that are in circular icons contain mostly structured data. And the icons in square, the systems in square icons mostly contain unstructured data. And as many of you already know, structured data neatly fits in tables. Think of an Excel spreadsheet with columns and rows. Unstructured data, however, lives in documents, images, and videos. Think reports and CAPAs and audit findings. And some of the most critical insights for solving problems is trapped in that unstructured nature. But most analytic tools only focus on structured information, leaving key context behind. So how do we solve it? Well, first, we have to connect the data within its own system. Before linking systems together, we first need to understand how the data connects within its own system, linking related records, surfacing patterns, and ensuring internal consistency. Data without structure leads to confusion. We need a clear framework that defines relationships and meanings within a domain, ensuring consistency across all systems in that space. The real challenge is translating across domains. We need to build structured connections between systems that preserve meaning, not just move data. Now let's explore each of these concepts in the next 3 slides. Let's start with a familiar scenario, one that happens every day in our plants. At Facility A, an operator working on an aseptic filling line submits a deviation report in the quality management system. The issue? A sterility breach due to improper aseptic technique during vial capping. The investigation follows a standard process. Root cause analysis is conducted, corrective actions are assigned, and the deviation is closed. In this case, the quality team identifies root cause as human error, inadequate training. The corrective action, a CAPA requiring operator retraining. On the right side, you'll see a graphic representation of this investigation. This is how data within a single system, and in this case, an investigation, can be structured in a way that captures relationships rather than just isolated records. Each oval shape represents an entity, or what we call a node. These are the key elements of the investigation, such as deviation 789, the file capper, the sterility breach. The blue lines connecting them are edges. They describe how these entities relate to one another. For example, a deviation occurred on file capper A. The sterility breach contributed to the finding of human error, and so on. Now, what's important here is that we're not just looking at records in isolation. This is a structured way to connect the information, how events, actions, and decisions link together inside the investigation. This is what we call a knowledge graph. It's the ability to map relationships between data points rather than just listing them in a database. This is just one investigation in one system. What happens when we start looking for patterns across multiple investigations, systems, and sites? Now that we understand how data is connected to the system, the next step is how do we define the rules? At facility A, we started with a single investigation, a deviation log for a sterility breach during vial capping. Root cause, human error. Corrective action, operator retraining. Sounds familiar. This is a common conclusion in investigations, but let's take a deeper look at what happens when we structure the data in a different way. First, we define relationships. A deviation has a root cause of human error. This follows a structured format: subject, relationship, object. Deviation 789 has root cause, human error. And critically, this relationship has a direction. A deviation has a root cause, but a root cause doesn't have a deviation. This relationship structure or ontology can be applied across every node and every edge in a knowledge graph. Now, what happens when we apply that relationship across the entire system? Instead of looking at a single deviation in isolation, we surface every instance that follows the same pattern. We suddenly see that there are multiple deviations at the site, each citing human error, each resulting in operator retraining for sterility breaches. But it doesn't stop there, because the knowledge graph allows us to connect across multiple facilities. It identifies these same patterns are showing up at another site on another file capper. This is how we uncover systemic issues that wouldn't be obvious in a standard QMS review. Now, at this point, we've just talked about the node-to-node relationships, but we can introduce logical ontology rules to test whether the pattern we're seeing is part of a larger issue. A new data point here is, a year ago, we had an FDA inspection where the regulator found an observation that we had a failure of the CAPA system to adequately investigate root causes. Essentially, the site was kind of copping out to human error too quickly. First, we flag every deviation that lists human error as the root cause. Then we check whether the CAPA linked to each of these deviations resulted in retraining. Next, we cross-check with audit finding 333, which was the finding that cited failure of the CAPA system to adequately investigate root causes. And finally, we escalate the cases that meet all of these conditions, because if human error keeps appearing, it might not be the true root cause. So what started as a single investigation has now expanded to a multi-site systemic issue. Instead of reacting to individual deviations, we're proactively identifying hidden risks. This is the power of structuring intelligence. When we move beyond standard business rules and look at the bigger picture, we don't just find patterns, we find solutions where problems repeat themselves. Now, we started with a sterility deviation linked to human error. When we expanded our view and identified similar deviations across multiple sites, but retraining alone didn't solve the issue, so we need to look beyond the quality data and into the broader system. Just a note on the illustration here, had I tried to map every single pathway here, it would have gotten quite confusing, so I just mapped a one. So a little grace on the illustration here. The key question that we're posed with is, was it truly human error? Our first step is, by linking the quality data with the maintenance data, We find a critical connection. Work order 846 was executed on file capper A, the same equipment tied to the sterility breaches. It also, work order 846, occurred before all of the deviations in question. This connection wouldn't have been obvious in either system alone, but by integrating the data, we start to see a bigger picture. Digging deeper, we find that spare part 123 used in multiple vial cappers across the site. Now, this spare part exists in both the maintenance and supply chain systems, but with different contexts. You can see this is going to be a spare part unique identifier number. It's going to exist in my work order system and supply chain system. And so the logical relational database answer is just link the key fields. In that case, we would lose context. In the maintenance system, the spare part is used to track on work orders, bill of materials, and installation history. But in the supply chain system, it's used to manage procurement, vendor quality, and manufacturing changes. So as we cross the domains from the work order system into the procurement system, we find out that spare part 123 is manufactured by manufacturer XYZ, and a few years ago, they issued a change notice. Material change notice 234 was issued for this part, but it was only scanned and attached to the purchase order, never flagged for maintenance or risk assessment. The warehouse technician did not do anything wrong. Procurement requires any manufacturer to file any material change notice or any changes to the spare parts to file with a purchase order, but there's no site procedure to escalate that change for review. The part was installed without awareness to the change, leading to the undetected sterility failure. This was never human error. It was an upstream material issue. A later investigation shows that the change in the formulation on part of the spare part ultimately led to the sterility breach. What started as an isolated deviation blaming operator technique has now surfaced a systemic issue, a material change that unknowingly impacted sterility performance. And because we've captured this new investigation inside of our structured knowledge graph, future sterility deviations on vial capping will automatically surface this connection, turning a one-time discovery into an enterprise-wide risk mitigation strategy. This wasn't just a lucky investigation. It was structured intelligence at work. And now that we have this framework, we can apply it to uncover and prevent future issues. Let's take a step back and look at core concepts. On the left-hand side, connecting at its foundation, a knowledge graph connects data points to reveal relationships that aren't immediately obvious. Instead of isolated records, we create a network of connected insights, turning scattered data into structured intelligence. But connections alone aren't enough. We need structure. In the middle, ontologies define the blueprint, how data elements relate to one another, what governs them, and how we ensure consistency. This is what gives our AI the ability to understand and reason through complexity. Finally, bridging across domains is critical. Each function, quality, engineering, or supply chain, has its own language and context. On the right, cross-domain ontologies let us connect these words in a meaningful way, ensuring that insights from one domain inform decisions in another. So now that we've established these core concepts, let's talk about the real challenge, which is scale. We're not dealing with a few reports or databases. We're talking about petabytes of information spread across thousands of records. Understanding the full picture means mapping millions of nodes, relationships, and rules. The scale of the data alone makes traditional methods impractical. We touched on this earlier, but it's worth revisiting. Some of the data is structured or organized in searchable databases, but a massive portion is unstructured, hidden inside investigation reports, audit findings, and free text fields. Without the right approach, critical context is locked away, impossible to analyze at scale. And finally, in my previous project, it took dozens of people years to manually analyze a fraction of this data. And even after all that effort, there was no mechanism to continuously surface new patterns as they emerged. The reality is no one has that kind of time. So how do we solve this? How do we process information like humans, navigating across topics, making connections, and identifying patterns? Doing so manually is impossible at scale, but as humans, we navigate complex relationships and cross domains effortlessly. Think about how we naturally communicate. In a single conversation, we seamlessly transition between topics, work, family, sports, hobbies, without ever needing to stop and reconfigure how we think. This isn't something we actively plan, it's just how human communication works. The reason we can do this is because we inherently understand context. We know which relationships are meaningful and which ones aren't. AI is really good at understanding relationships. Sorry, hold on one second. Yeah, AI is really good at understanding relationships. It's very good at understanding patterns. However, AI, through the disciplines of natural language processing and large language model, can decode this human communication, extracting meaning, context, and relationships to construct knowledge graphs and ontologies. However, left to its own devices, it will frequently find relationships not grounded in truth and the answers not grounded in reality. This is why AI alone isn't enough. If we want meaningful insights, we need to guide the AI with human expertise. To show how this works, we took a real world example. We started with 2,000 raw FDA 483 observations. We started in their raw PDF format, unstructured text, and various degrees of redaction. We built an ingestion and processing pipeline. Unoptimized, it took about 10 hours, and the AI had generated the first knowledge graph and ontology based on the first 200 records. At this point, it wasn't perfect, but it didn't need to be. The AI had done the heavy lifting in structuring relationships across thousands of data points. My job was to scrutinize the blueprint, identify gaps, correct errors, and refine connections. The cycle repeated for a few weeks, each iteration making the knowledge graph more precise, more structured, and more meaningful. And by the end, we had an ontology and knowledge graph that accurately reflected the data. After a few weeks, this is what we produced. This is what the AI generated knowledge graph looks like after processing all of the FDA 483 data. At first glance, it's an impressive structure. Thousands of data points linked through relationships, forming a vast web of interconnected observations, findings, and causes. But here's the challenge. How do we actually use it? If I asked you to find major systemic issues in this, could you? The complexity is overwhelming, and manually tracing trends is nearly impossible. So the real question comes, how do we surface meaningful insights? Now that we have the structured data into a knowledge graph, we can use a large language model to interact with it, asking questions in plain language, surfacing insights that would take weeks or months to extract manually. Here, and this is a screenshot from the tool itself, here we ask a simple question. Tell me about themes and observations involving kappas. The response is based on the patterns and relationships within the graph, highlighting common regulatory findings. The results are not surprising, and these are recurring industry challenges. So it's a bit of an eye chart, so I'll recap. Inadequate kappa implementations, failure to address root causes, lack of corrective actions, inadequate investigations, and delayed kappa closures. Now, we could continue to use this large language model, much like a chatbot, and continue to refine and dig deeper in our answers. Or we could visually explore the graph to uncover broader systemic issues. Now let's look at where the LLM response came from. This graph represents the structured relationships behind the answer we just reviewed. These aren't raw data points, they're connected insights forming thematic communities. This first community down here is where the LLM extracted its response. It clusters together kappa-related findings from FDA 483s, highlighting recurring issues across multiple inspections. But now we see something a bit more interesting. This much larger community closely related to the first, it centers around contamination control issues, and specifically regulatory observations citing companies for failure to address true root causes. And here's the critical connections. Recently, regulators have been flagging companies in their contamination control programs for failure to address true root causes and attributing them to human error, resulting in retraining. This is exactly what we saw in our earlier example. Now, this is a great tool for root cause identification, This would be a great tool for retrospective review on deviations instead of our standard keyword search. And while it's helpful to explore these ideas visually, a key question remains. Where do we start? In operational excellence, we always want to use our Pareto principle, focusing on the 20% of factors that drive 80% of the issues. And this is how we do it. We saw what appeared to be an overwhelming mass of nodes and a dense web of information. The question was, how do we make sense of it? How do we extract what truly matters? Well, here we take that raw graph and we apply advanced AI techniques to organize the data into more meaningful structures. The two key mechanisms at play are natural clustering algorithms and hierarchical, I have a hard time with that word, community stacking. The first step is to let the data naturally form clusters based on relationships and similarities. These algorithms automatically group connected information, revealing patterns that may not be obvious at first glance. And in this case, they've been color-coded to represent their various communities. Once those clusters form, we take it further. Hierarchical community stacking organizes insights across different levels. Think of this like zooming in and out on a map. At the highest level, we see broad themes and major trends, but as we drill down, we get more granular across root causes, failure modes, and surfacing high-impact areas for intervention. Finding the true root cause shouldn't take months, but for many organizations, investigations stall, deviations recur, and compliance issues resurface, delaying supply to patients and draining resources. These aren't software problems, these are intelligence problems. Introducing Synaptic Impact, CAI's results-driven consulting program for AI-powered operational excellence. There is no easy button for this work, easy AI button for this work. Real impact requires more than just insights. It demands the right expertise, leadership alignment, and a structured approach to driving change. That's what we deliver. Our elite team of operational excellence, data science, and engineering experts embed within your organization, working inside your data environment to surface hidden inefficiencies, uncover systemic risks, and drive real, measurable improvements. And we don't stop at insights. We bridge the gap between data and action, building organizational buy-in, structuring solutions, and ensuring changes stick. Synaptic Impact is where AI-driven intelligence meets real-world results. I want to thank everyone for being here today, and I hope this discussion has given you a new perspective on digital twins, seeing them not just as another technology initiative, but as a practical tool that can deliver immediate ROI and serve as a foundation for longer-term initiatives. On the AI side, I hope you found the knowledge graph discussion insightful, seeing how structured intelligence moves us beyond standard business rules to uncover hidden patterns, solve problems faster, and drive better decision-making. At the end of the day, operational excellence is about eliminating variation and maximizing output. But real impact takes more than just tools. It takes the right expertise, the right process, and the right partner. That's what we're building. We'd love to be a part of that journey. Let's keep that conversation going with what challenges you're facing and how we can help.
Excellent. Thank you so much for that great presentation. I'm going to pop back on and just give a little reminder to our audience. If you would like to submit a question and haven't yet, you can go ahead and do so now through that submit question box. We're going to go to our first audience question. And this question is asking, what are the biggest challenges you see in translating insights into operational change, and how do we ensure buy-in across teams? Who can help me with this one?
I think I can take that one. So this is a great question because it goes way beyond AI. It's about adoption, adoption of changes in technology, about changes in infrastructure, and everything around the technology and the innovation and improvements we've seen in every aspect of our business. So as Nick said, there's no easy button, right? So a lot of it comes down to a leadership challenge and connecting all levels of the organization through a myriad of different initiatives, right? So, and I'll just use an example. One of the things that we're doing on the mission critical side is we're determining how we can use AI internally with our own processes to deliver for our clients more efficiently. So part of that project, internal project that we're running, is to invoke the knowledge and the experience of people that are actually executing our projects. And that really creates that buy-in. And with their participation in the actual project itself, they feel like they have that commitment, like they think that we're going somewhere with it, right? Which is really at the end of the day what we're trying to do. So, and then there's the other aspect of it, which is, I guess you could say, the investment side. So it's going to require investment, and when that happens, that tends to get people more interested and more bought in, I guess you could say, across the team. So it is going to be a leadership challenge. It's going to be an operational challenge, and I think it just starts from the top, and you have to involve as many people in the organization as you can to be able to induce that change.
Okay, very good. Thank you so much for that. And the next question from our audience. The data often points to systematic failures rather than individual mistakes, yet human error remains a frequent root cause in deviations. How can organizations shift from reactive training fixes to proactive system improvements? Who can help with this one?
Yeah, so I give a pretty simple answer to this one, and it's where we start with there's no such thing as human error. When you start your program for eliminating human error and you start there, we make the automatic assumption that everyone came to work today to do their best job. If they didn't, it's negligence and we have a bigger issue, right? Everyone came to work today to do their best job. And in that case, there's no such thing as human error, but the failure of a process. So if someone made a mistake, we need to take a look at that underlying process and remove those roadblocks so that person doesn't make that mistake. I'll give an example of this, and this actually harkens back to that project that I talked about from several years ago. During that finding, and this is one of those kind of odd times when kind of the duh moment, the aha moment, and the duh moment came together, as I call it. We're sitting there, and there's a bunch of us going through paperwork, and somebody goes in and says, "Does anyone realize that all these human factor, we don't call it human error, we call it human factor issues come in the last 2 hours of a shift?" And it makes sense. Folks are tired. It's a 12, 13-hour shift. So the answer to that wasn't go home and get more sleep. The answer wasn't, well, we need to make sure we have really clear instructions and go rewrite all of our procedures. Right? The answer was, how can we remove as much distraction, especially during those last 2 hours, to give our folks the best chance of success when they're the most tired? The answer to that was we removed all critical processing steps in operations from the last 2 hours of a shift. We wanted them concentrating on shift changeover and good documentation. Now, they flipped it first. Ops had a fit because they thought it was going to slow us down. And at first it did. And we really messed up the scheduling at first. And within about 90 days, when we got it right, we actually saw overall, whether it was in the last 2 hours or not of a shift, we saw an overall 23% drop in human factor deviations across the board. And one simple change.
Excellent. Thank you so much for that. All right, let's see, back to our audience questions. This question is asking, how do we strike the right balance between leveraging AI's capabilities while maintaining human-driven operational excellence? Who can help with this one?
Nick, you want me to take this one or start off with it?
Go for it.
All right. So this is the question that comes up quite a bit when you talk about AI. So, there's a lot of concern out there. Is AI going to start replacing everybody's jobs? Well, I think that is just, not reality myself. It's there to enhance the work. So how do we strike that balance? Well, we still have to have the human thought and the presence of mind to say, okay, AI might bring me the 80% solution or 90% solution, but I still have to get it the rest of the way, and I still have to figure out how to, if the solution is working. And the operational excellence piece of it, some of it just comes down to intuition, and we have to be able to enable that intuition from a human thought process to be able to say, okay, all the solutions we're putting in place, they're working, or we need to revise, whatever it may be that AI is providing us to further enable that operational excellence. So how do we strike that balance? I think we're still at the precipice of just figuring that out, to be honest. And as we continue through this journey, it may become more obvious, and maybe we can use AI to help us figure that out, to be honest.
Okay, very good. Thank you so much for that. And now back to our questions. Let's see here. Our next audience question is asking, what is digital twin technology?
Good question. I probably should have defined that up front. Digital twin technology, and the general kind of accepted answer or definition that I use is twofold. Number one, it is a virtual representation of a physical thing or process, right? In our case, we're creating a virtual representation of the entire plant. The second part of digital twin is where the virtual representation is fed data in real time from its physical counterpart. Okay, both of those things come together before we really start defining something as a digital twin. Digital twins really kind of main purpose here, and it's kind of, I'd say it's golden ring, what you're trying to go after is simulation. If we can get everything baked into our digital twin well, can we simulate a lot of testing and process validation? And so we can get rid of a lot of the iterative testing and be right first time. Can we simulate technology transfer between two different facilities and give ourselves a better chance of success? Or something maybe a little bit simpler is we want to put in an engineering change and we want to test our unintended consequences, right? Those happen because we only think about so many things. Getting to this point is a challenge, and there's another one in there. Have we seen successful validations of digital twin platforms in pharma industry? And Bruce, I can't answer that question because I haven't seen it. I have seen it used in specific applications, but not as part of a validated submission. But what I have seen is a lot of organizations will approach it from one of two directions. The one direction is it is a data side where they hit it everything from the data side, and then they come in it from the physical model side, right? They'll start with a basic rudimentary model, and then they'll hit it with all the data, and then they'll try to come in later and update the model. We approach it from a different angle where we're coming in with a hyper realistic model. Our approach is that way for a reason, and it has a lot to do with the services, with a lot of the core services that we provide around testing as-built conditions, right? My goal is to capture those as-built conditions digitally, and there's a lot of things that we can automate when we do that. So we've taken it kind of from that opposite step. But your definition is virtual representation of a physical thing or process, and where the virtual object is fed real-time data from its physical thing in real time.
Okay, excellent. Thank you so much. And the next question is asking, actually, it's a statement. That graph looks pretty. What do the colors mean?
Yeah, it is pretty. I was kind of excited by it. Okay, so going back, this pretty graph. What you're seeing here is all of the FDA 43 records that have been clustered and stacked. When we zoom all the way out here, we're picking up on about 7 or 8 different colors. So what we're picking up on is 7 or 8 different major themes or findings or major communities that are attributing to these FDA 483 findings. Now, generally speaking, you could probably get through a lot of this stuff by just a lot of the traditional kind of dashboard analytics that you can get to, right? The way that we interact with this is I can take that entire purple community that's an offshoot out there. I can attach large language model to it and really start summarizing and characterizing what's in there, right? Once we get the community stacking on there, that's the real power behind this. Now, this looks like a pretty graph, and it is. The real power behind this is not only do I get those big themes, but as I start drilling into it, we start drilling it. I almost call it, we start kind of drilling back in time, and we start going down those major causeways as to what the big interventions we need to make are. This is we started with the 483 data, really trying to mimic client deviation data as a surrogate as we go into this, and the similar approach would be our intent. The other intent behind this is change management and trying to get an organization behind a big effort like this to go after. Again, we were writing off tens of millions of dollars a year in lost product, and it took us 3 years to get it done. Can you imagine the amount of attention span and stick to itness that it took to keep the leadership on point for 3 years to drive? Now, we made a significant change, but that took a lot of focus. Graphics like this, data visualization like this helps you tell that story so much better, right? So this is part of that process that we use to help you tell your story so much better, to gain that executive buy-in, so that we can go after those root causes. But those colors represent communities of very like issues that we can then drill into, summarize, and kind of drill too deeper to find root causes.
Okay, thank you very much for that explanation. And we have time for another question. This question from the audience is asking, has there been successful validations of digital twin platforms in the pharma industry?
Oh, sorry, I already answered that one. And Bruce, not that I'm aware of, I apologize. There are some early cases being used that I'm aware of, where many of the life sciences companies are building exact replicas of facilities, right? So they're kind of stamping these out, and they are using the attempt is to use the digital twin technology to help in the design and understanding the changes of each facility as they go along. But I have not seen anything from a validation approach.
Okay, sorry about that. Thank you. Here will be our actual last question. This question's asking, how many different data sources were used in the FDA 483 examples, and was the data structured and unstructured?
Yes, good question. So we pulled it directly from the back end of the FDA website, directly from the write-up records themselves, right? So they all came in PDF format. So they're all unstructured in nature. It was a particular mess because there's kind of fun handwriting on them at times. There's interesting redactions at times. I believe, and I'd have to go back and talk to the architect, there was some structured data that came to us in a spreadsheet form where they captured some of the metadata pieces that we use for grounding on the graph. But mostly it's from that unstructured PDF data that came out of it.
Okay, very good. Well, that is our time for today. I want to thank both of our presenters for their time and the information they shared, and to you, the audience, for watching. We hope to see you next time on Pharmaceutical Online. Have a great day. Bye-bye.
Bye, everybody. Thank you.
Thank you.